Have you ever thought that your evening routine might be silently endangering your life? It sounds concerning, but according to the Centers for Disease Control and Prevention, CDC, over 70,000 elderly individuals pass away during sleep annually in the United States alone. What's truly disturbing is that many of these deaths aren't simply due to advanced age, but are connected to avoidable sleep-related behaviors that most individuals never question. As we age, our bodies become increasingly sensitive to even minor changes. After reaching 60, your heart, brain, and respiratory system all become more vulnerable. Sleep cycles change, muscle strength decreases, and the dangers associated with seemingly innocent bedtime habits grow considerably more significant. Yet most older adults maintain the same routines they've followed for decades, unaware that these practices could be quietly undermining their health and potentially shortening their lives. So, what are these concealed risks hiding in your nightly routine? Which common sleep habit causes more emergency situations than any other? All right, let's begin. Habit number 3, getting out of bed too quickly. Have you ever woken up in the middle of the night, swung your legs out of bed, and suddenly felt the room spin or your vision darken? If so, you're not alone, and you're not imagining things. For seniors, getting out of bed too quickly can be a surprisingly dangerous habit, one that's responsible for countless falls, injuries, and even hospitalizations every year. The main culprit behind this phenomenon is something called orthostatic or postural hypotension. This is a sudden drop in blood pressure that happens when you move from lying down to standing up too quickly. As we age, our bodies become less efficient at adjusting blood flow and pressure when we change positions. The result? Blood momentarily pools in the lower part of your body, and your brain doesn't get enough oxygen-rich blood for a few seconds. That's when you feel dizzy, lightheaded, or even faint. This isn't just an uncomfortable sensation, it's a real danger. According to a study published in JAMA Internal Medicine, older adults with orthostatic hypotension are at significantly higher risk of falls, fractures, and even death. In fact, falls are the leading cause of injury-related hospitalizations among seniors. And many of these accidents happen at night or early in the morning, when blood pressure is naturally lower and the body is still adjusting from sleep. The consequences of a nighttime fall can be severe. Hip fractures, head injuries, and wrist breaks are common, and recovery can be long and difficult. For some, a single fall can lead to a loss of independence, prolonged hospital stays, or even life-threatening complications. That's why it's so important to take this risk seriously and adopt safer habits. So, what can you do to protect yourself? The good news is that a few simple changes to your nighttime routine can make a big difference. First, when you wake up, don't rush. Take a moment to sit on the edge of the bed and let your body adjust. Wiggle your toes, flex your ankles, and take a few deep breaths. This helps your circulation catch up and reduces the risk of a sudden blood pressure drop. Keep a glass of water by your bedside and take a small sip before standing up, especially if you're prone to dehydration. Make sure your path to the bathroom is well lit. Use night lights or motion-activated lights to avoid tripping in the dark. Hold on to a sturdy piece of furniture or a handrail as you stand, and avoid slippery socks or loose rugs that could cause you to slip. Wearing non-slip slippers and avoiding clutter on the floor are also smart precautions. If you take medications that can lower your blood pressure, talk to your doctor about the best time to take them and whether your dosage needs adjusting. By following these simple steps, you can dramatically reduce your risk of nighttime falls and protect your long-term health and independence. Remember, getting up slowly isn't just about comfort. It's a powerful way to stay safe and confident every single night. Habit number 2, ignoring snoring, breathing stops, or insomnia. Snoring is often brushed off as a harmless annoyance, especially as we get older. But what if that nighttime noise, or the pauses in breathing that sometimes come with it, are actually warning signs of something much more serious? For seniors, ignoring symptoms like snoring, breathing interruptions, or chronic insomnia can quietly set the stage for life-threatening health problems. One of the most dangerous and underdiagnosed sleep disorders among older adults is obstructive sleep apnea. This condition occurs when the muscles in the throat relax too much during sleep, causing the airway to narrow or close completely. As a result, breathing can stop for several seconds, sometimes hundreds of times a night. Each time this happens, the oxygen level in your blood drops, forcing your heart to work harder to keep your body supplied. Over time, this repeated strain can lead to high blood pressure, irregular heart rhythms, and a much higher risk of heart attack and stroke. The numbers are alarming. According to the Sleep Heart Health Study, untreated sleep apnea increases the risk of fatal heart attacks by 30% and strokes by up to 60% in older adults. Even more concerning, nearly 40% of seniors are affected by sleep apnea, but an estimated 80% of cases go undiagnosed. Many people simply don't realize that their snoring or restless nights are symptoms of a serious medical condition. But the dangers don't stop with the heart. Sleep apnea also robs you of the deep, restorative sleep your brain needs to function at its best. Chronic sleep deprivation can lead to memory problems, confusion, and even accelerate the progression of dementia. In fact, studies have shown that seniors with untreated moderate to severe sleep apnea experience brain shrinkage in areas responsible for memory and decision-making at nearly 3 times the normal age-related rate. So, how can you tell if you might have sleep apnea or another serious sleep disorder? Often, it's a partner or family member who notices the signs first. Loud, persistent snoring, long pauses in breathing, gasping or choking during sleep, and frequent awakenings. Other red flags include waking up with a dry mouth or headache, feeling extremely tired during the day, or struggling to stay awake during quiet activities. Insomnia, difficulty falling or staying asleep, can also be a warning sign. While occasional sleeplessness is normal, chronic insomnia can signal underlying cardiovascular, neurological, or hormonal issues. It also weakens the immune system and increases stress, making it harder to manage conditions like hypertension and diabetes. If you recognize any of these symptoms, don't ignore them. Talk to your doctor or a sleep specialist. Treatments like CPAP, continuous positive airway pressure, therapy, weight management, and lifestyle changes can dramatically reduce your risk. In fact, research shows that treating sleep apnea can lower cardiovascular risk by up to 42% in seniors. Remember, snoring and insomnia aren't just nuisances. They're signals from your body that something may be wrong. By paying attention and seeking help, you can protect your heart, your brain, and your quality of life. Habit number 1, taking certain medications before bed. For many seniors, taking medication before bed is a nightly ritual. Whether it's a sleeping pill to help you drift off, a blood pressure tablet, or a painkiller to ease sore joints, these routines can seem harmless, just another part of winding down. But what if this habit is quietly putting your health at risk? The truth is, certain medications taken at night can have unintended dangerous effects, especially as we age. Let's start with sleeping pills and sedatives, which are commonly prescribed for insomnia and anxiety. Medications like benzodiazepines, such as diazepam, clonazepam, and alprazolam, work by slowing down the central nervous system. While this can help you relax and fall asleep, it also makes your breathing slower and shallower. For seniors, especially those with heart or respiratory conditions, this can be risky. According to a study published in the British Medical Journal, older adults who regularly use benzodiazepines have a significantly higher risk of falls, fractures, and even death compared to those who don't use these drugs. The sedative effects can linger into the next morning, causing dizziness, confusion, and unsteadiness, all of which increase the risk of nighttime accidents. But it's not just sleeping pills that can cause problems. Some antidepressants and muscle relaxants, often taken at night, can interfere with the deep stages of sleep that are essential for memory and cognitive health. Over time, this can lead to increased forgetfulness, confusion, and even accelerate cognitive decline. Painkillers, especially non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen or diclofenac, can also be problematic when used frequently. These medications can overload the kidneys and liver, making it harder for your body to eliminate toxins. They can also increase the risk of internal bleeding, especially when combined with other medications. Blood pressure medications are another common culprit. While some people benefit from taking these drugs at night, for others, it can cause blood pressure to drop too low during sleep. This can reduce blood flow to the brain, increasing the risk of dizziness, fainting, and even stroke. A study in the journal Hypertension found that the timing of blood pressure medication can significantly affect nighttime blood pressure patterns and overall cardiovascular risk. Drug interactions are another hidden danger. As we age, our bodies process medications more slowly, and the risk of one drug amplifying the effects or side effects of another increases. Mixing sedatives, painkillers, and other medications without medical guidance can lead to dangerous, even life-threatening complications. So what can you do to stay safe? First, always consult your doctor or pharmacist before starting, stopping, or changing any medication. Ask if there are safer alternatives, especially if you're experiencing side effects like confusion, dizziness, or excessive drowsiness. Avoid unnecessary sedative medications and try natural sleep aids such as herbal teas or relaxation techniques when possible. If you take blood pressure medication at night, monitor your readings regularly and report any unusual symptoms to your healthcare provider. By being proactive and informed about your medication routine, you can protect your health, reduce your risk of nighttime accidents, and ensure a safer, more restful night's sleep.